is the Q&A, the million-dollar question you can ask. Like what Dr. Lin has encouraged you, you're here today, you should get all the information. Anyone have any questions? Did I see a hand behind? Okay, I see you in red. Just a moment. I come to you. I come to you first. Okay, hold on.
Can I?
We need the microphone over here on. Yes, try again.
Hello?
Yes, we can hear you.
Yeah. Can I know whether we can breastfeed after the breast reconstruction?
Can you breastfeed after reconstruction surgery?
Hi.
Hi.
Thank you for your question. Generally, because the reconstructed breast itself is actually made of fat and skin from another part of the body, so it doesn't function like a breast tissue. So the short answer is no, especially if you have implant, but you have the other breast, which is not affected by surgery or by the reconstruction. And if you are at age where you have a child and you need to breastfeed, and that's still possible.
How long after breast reconstruction surgery you would suggest that they breastfeed with the other breast that didn't have reconstructive surgery?
In general, I think it has to tie in with the entire breast cancer treatment. So it's not just, we don't just consider the breast reconstruction in isolation. So you have to look at your overall recovery after major surgery. Also, in terms of the breast reconstruction, generally my patients will recover with about 3 to 4 weeks, and they are back to office, exercise, whatever not. So that's probably a safe time period. But again, I like to bring your attention back to the larger picture, which is the breast cancer, as well as the breast cancer surgery and treatment. So in that perspective, the timeline may vary.
Dr. Khoo?
Typically, after a breast cancer surgery, the patient will be followed up with us for at least 5 years. But now we are beginning to follow up the patient for the rest of their life, actually. So the screening is usually through clinical examination by the doctor or specialist, and ultrasound and mammogram. So this will be done yearly after the surgery and the treatment.
So you're encouraging them that actually complete the treatment for breast cancer, and then you can continue with the second part of it if you do breastfeed.
The breast screening for breast cancer.
Breastfeeding.
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 For breastfeeding after
yeah.
So if this is an early breast cancer, usually they do not require chemotherapy and they won't be on the hormonal therapy. So most of the time, after 1 year, they should be able to go back to breastfeeding.
Okay, thank you. So breast screening, you got a extra bit. So breast screening, if it is detected, is the lifetime follow-up with the doctors. Next question.
Hi, my name is Shirley. I'm also a breast cancer survivor. In fact, Dr. Jerry is one of my surgeons, and Ms. Kong, hi. Okay, in one of those slides that I saw, the rate of women with breast cancer increases after the age of 40 and 50. So my question is, why is it that women above 40, you only need to do mammogram once a year, and if you are above 50, you do it once in every 2 years?
Well done. This is a question.
Yes, this is a question that I get a lot from medical students and from the community as well, because simply because the breasts are different before the women reach menopause and after menopause. So before menopause, usually, especially Asian women, they tend to have a dense breast. So mammogram is an X-ray imaging that require fatty breast to look at it better. So when we have a dense breast, it's harder to see small calcification or lump. Therefore, to be very safe, the routine screening below 50 years old is done yearly, because before 50 years old, women tend to have denser breasts. But above 50 years old, what we found after menopause, usually the breast become fatty. They are less shadowing, therefore easier to see. Therefore, we do 2 yearly after that. This is the reason why, the density of the breast before menopause and after menopause.
We have a question behind.
Hi. Is there an age that stops the mammogram?
What's the stopping age?
What is the stopping age for mammogram?
So that's another question that I ask a lot as well. So according to Health Promotion Board, the screening is from 50 to 75. This is a recommended age group. However, we know that Singapore is currently aging. In fact, now our patients live up to 85. In the future, this may go up to 100 in matter of 20, 30 years, because we know more about diseases, we are doing prevention, we are eating more healthily, we are exercising. Therefore, this 75 is arbitrary. We don't really follow it. In fact, if the patient is very well at 75, 80, they are still independent, moving around, I would encourage them to continue 2-yearly mammogram. And Health Promotion Board agreed to do this screening mammogram beyond 75 or so.
So what is precious to you? What is the most expensive thing you own? What's that? Life, exactly, your health. So if you're going to live long and you're still healthy, then continue. You know, you send your car for maintenance every year, maybe twice a year. Likewise for yourself, go for your health screening, continue. And usually if you go for a health screening, your doctor will say, I'll see you next year, when they will put the next date for you to do that. And if they follow up closely with you, and you don't know why, it's not because he likes your money or he likes your face, you know, well, he likes you, but because there's something he wants to follow up. Ask questions. Ask, why do you see me every half a year? Why do you see me every year? Why do you say you see me in another 2 years? Why? It's okay. You know, Dr. Lim says, you know, the H, that's the why. Sorry, the W. The W, that's the why. Why? They will explain to you. Not because my doctor see me every half a year, you know, or yearly. Why? Why yours every year, mine every 6 months? Why? Ask that question. He's there to answer your question. So you ask. And if they follow up and see you next time, then continue to see. Doesn't mean that you give up when you turn 75, 85. So there's no stopping age, the straight answer. And as it goes, Health Promotion Board allow you to do it longer. Continue. Question. Over there. Hold on. Gentlemen, wait. I see you. Don't go. You want to come forward?
Regarding the mammogram, there's no radiographer here. But I heard that, I read somewhere, you know, when you do a mammogram, there is a thyroid scan, right? Thyroid, to protect your thyroid. The question is, when we do mammogram, the radiographer don't put the shield, you know. So
On you or on herself?
No, on you.
On the patient?
On the patient,
Okay.
yes. So does she knows that there is a protection shield for your thyroid?
Okay, we have a radiographer on stage. Yes. Miss Chai.
Hi. With that question, can you all hear me?
Yes.
Okay, all right. That is a very common question that most women ask. All right, because basically mammogram is a really low dose radiation, and in fact, putting a thyroid shield around your neck, it will actually block the area which we want to image. Then, if you block, then I have to take it out again, and I repeat the area. So what is that useful for you if I will have to do it so many times just because of that? And it's of no diagnostic value if the images is not captured clearly, right? So it's not true because I know that articles is actually circulating right from US with the YouTube. A lot of women actually ask that and circulate. In fact, in the Singapore Health Science Authority, they have issued a memorandum through all the major hospitals. I checked with them, and the memorandum says that we all stand by the unit that we do not offer thyroid shielding, all right? And it's actually very safe for it because requesting doctors like Jerry Khoo will actually decide how many times you come in for a mammogram, yearly or 2 yearlies, depending on your age group and also your condition, right?
So please be rest assured. And the fact that our mammogram units in Singapore, in fact, also in Khoo, Teck, Puat, is all screened through periodically with the QC, QAs and everything. So we do take care of our machines, and it's all according to guidelines. In fact, to be able to operate this machine, we need Ministry of Health licenses. So can I reassure you that do not ask for any thyroid shield, because sometimes it puts the radiographer in a difficult position. Some radiographer, they are unable to explain like this in so much detail, but because basically we have taught most of our colleagues to actually really tell the lady, there's no need for it, please be assured. Yeah, just stay still and cooperate with us for a few seconds. Thank you.
Thank you. Well done. Thank you. This is the beauty, because you're in the hospital, everybody's here. Get answered. You always get an answer. And I think one important thing is the doctor actually prescribed, the mammogram. So, if they say 2 years, don't every year it's like, maybe I should do it again. I should do it again, So it depends on your condition. You have a question, sir?
Two of my relatives had breast cancer some 10 over years ago. The older one, when it was detected, was at quite an advanced stage, and the surgeon advised removal of the whole breast. The younger one, it was detected at an early stage, so the surgeon just removed the lump. The older one still healthy today, but the younger one succumbed to a relapse a few years later. Another reason is that the older one, the doctor gave her 2 options for the chemotherapy. What's your question? Later. The doctor allow her to choose. The more expensive one, the survival rate will be higher. The cheaper one.
So what's your question?
My question is that removal of the whole breast will give the patient higher survival rate. Is that the case? The second question is that, can a doctor always give the most effective prescription for the patient, or whether the cost is a consideration when the doctor prescribes the cost of treatment?
Okay.
Thank you. Thank you for your question.
Okay, thank you. Firstly, I sympathize with your situation where you have 2 relatives being diagnosed with breast cancer. That just goes to show that breast cancer is actually common in Singapore. About your question, this is a study that has been done over 30 years involving millions of women. So when we talk about lumpectomy versus mastectomy, which removal of the entire breast, the survival of this patient, long-term survival beyond 20, 30 years, is the same. They are the same. However, the caveat is, after the women undergo a lumpectomy, this must be accompanied with radiotherapy. So in terms of survival, the cancer returning to the breast or the body, it's actually the same. The benefit of lumpectomy will be preservation of the breast and improve the image of the women. So I think there is a benefit of lumpectomy. My approach is, if we can do a lumpectomy for the women, it will be better than mastectomy. Having that said, it's an option for the women. So after a mastectomy, there's an option of breast reconstruction that perfectly look well as well for the women. Number 2, I can't comment on hospital outside public institution, but in public institution, KTPH, NUH, SGH, Tan Tock Seng, we practice a very evidence-based and the most effective medication, surgeries, and treatment for all our public patients. So we also take into account the value and the cost, the most cost efficient and effective to the patient. We won't choose like more expensive, but the effectiveness is the same as the cheaper medication. So be assured about that. Thank you.
Thank you very much, this gentleman, for sharing your personal experience. I think when you have your family members or you know someone really close to you to have been affected by breast cancer, then that definitely will have an emotional impact on you and the people around, and then that will then affect how you think about the situation. And when you think about it, even if you don't want to think about it, that is kind of like there's this background already that might have cast a certain shadow or impact on you. So thank you very much for then taking this opportunity to ask those questions that you have in your mind, because that will be very important in terms of determining in the future how would you approach treatments, and the females in your family as well, about how they approach treatments. So hopefully we will be able to answer some of your questions to allay some of the emotions that you may be experiencing. So thanks very much for that.
Thank you. And it's the first gentleman asking a question. Please give him a big hand.
Yeah, hello. I'm Pauline, and I used to go regularly for the mammogram, but each time mammogram, they refer me to hospital and to get the second view. So I'm just saying that my part is above 60, and it requires 2 years. What happened is that if I find anything that is discomfort in my breast, and it starts to have some pulling sensation, if I go in early for mammogram before 2 years, what will be the cost like? As what you say, early detection will be better rather than to go on after 2 years. I know they are heavily subsidized for 2 years. What is happened is that before 2 years, and the dots they are finding is right behind my nipple, and it's very difficult to really see it. I have to wait for a few hours in the hospital, and sometimes it takes 2 pictures or 3 to detect it. So I would like to know the cost.
So in this instance, is that before the time for the next follow-up, if she feels discomfort, if she goes back to the hospital?
They don't take my appointment at polyclinic for mammogram.
So she's not accepted by polyclinic. Are you a subsidized patient in the hospital? You are a subsidized patient.
No, so far I use Medisave.
You use Medisave, yeah, but you're paying a subsidized rate. You're paying a subsidized rate. So you were referred to a hospital by the polyclinic, and your follow-up is always with the hospital. Okay. So every year you just go straight to the hospital? Yeah, every 2 years you go straight to the hospital. So hold on. Every 2 years you go to the polyclinic or you go straight to the hospital? Okay. Okay. So if this is before she felt discomfort before the 2 years is up, what would be the suggestion?
About that question, I would say, in general, although women above 50 should go for mammogram every 2 years, in between, always be vigilant, do the self-breast examination monthly, and if you have any concern, you want it to be checked out by the doctor, please go to the polyclinic. And then polyclinic, after examination and all that, they will refer to us for further imagings and check. So even though if you go for mammogram screening regularly, it's still important to do the self-breast check every month. And if any concern, just go to a doctor to have it checked.
So for you, you still go back to the polyclinic. It doesn't matter. You're feeling discomfort, like what Dr. Khoo says. No. You go back to the polyclinic, you will be subsidized. Go back to the polyclinic. That's fine. When they refer you, you are subsidized. Don't wait. if something bothers you, more than 5 minutes means it's something that's bothering you. Don't wait till another year. Go back to the same route, continue. Your next question, this will be the last question. We have so many questions. Hold on. What's your question? Benign cysts, will it become cancerous? What's your question?
What's the difference between scanning, ultra scan and
mammogram?
Because ultra scan actually pick up my lung, but mammogram.
Okay.
So, why is it that there is deviation?
Yeah. So, shall we do the ultrasound and mammogram first? The question. I'll check what the questions so we can lump it together.
Okay, ultrasound uses ultrasonic sound waves. Each modality has its own uniquity. Basically, mammogram will be done first. Basically, you give an overview and architecture of the breast structure. And yes, you're right. Sometimes you may or may not pick up the lump from the breast, depending on your breast density. All right? The thicker the breast is, sometimes that's why Dr. Jerry Khoo has actually mentioned that you will need an ultrasound to pair with it. And most of the time, if you come to us, it's always mammogram, ultrasound, unless otherwise stated. Usually younger women below 40 or so, let's say about 35 or so, if they have breast lump, they come to us. The first line investigation for them is ultrasound, because no point doing a mammogram after below that age, you see, only at 40 and above. That's why the mammogram is actually very, very, very useful at 40 and above. Right? You get that? It shows. Yeah, it depends on your lesion. So if it subsequently, if it doesn't pick up, never mind, the doctor will actually uses the ultrasound as the guide to follow up. Because certain lesion shows better in ultrasound, certain lesion shows better in mammogram. Does that answer your questions? Yeah, because this is more of our, the way that we look at the picture, the pattern in the breast, okay? You mean there is no follow-up? No. Correct. Then that means it is not. It looks normal on the mammogram is normal. So if your ultrasound is some kind of like certain lesion like lumps, like that's fibroadenoma, for example, this is a medical term. Actually, that is very well versed pick up in ultrasound. So if it's that should be a very benign lesion. What we look at the mammogram is to also look for other suspicious lumps and a little calcification, which are all early signs of cancers as well. So this is not just pertaining to the thing. Your doctor might decide that, this year you will do a mammogram, then 2 years later, you don't have to do a mammogram. Depending on your condition, each woman is different. That's what I want to emphasize. Yeah. So speak to your doctor and ask why, because he or she has your record. I do not have, but for me, I can just give you a general guideline of that's what we see and what we do, and we will do according per se what we doctors requested. Yeah, they are very reasonable. They won't do that, do the overdo things or underdo things for you all, because we know that what is best for you. Yeah, sometimes we need both mammo and ultrasound to be together. Sometimes you need only one. It depends. Yeah. Does that answer your question?
Okay, question. Would a benign cyst become cancerous? Would the lump that you found earlier in the early stage, maybe in the 30s, be gone? And would the calcified breast recovered, which means, it was early stage, nothing to worry about, and then it was gone after maybe 4 years later with a mammogram, it wasn't a concern anymore. Is that possible?
Okay.
So it's a 3-in-1 question.
There are 3 questions. So number 1, breast cysts will not turn to become a cancer. However, it's still important. For breast cysts tend to happen in a younger patient, below 50 years old. And what happened is the usual question that I ask after I confirm that it's breast cysts, they will ask, would this become cancer? The answer is no. However, the same vigilance still need to happen. self-breast examination, go for screening mammogram, because the rest of the breast has the capacity to become cancer one day in the future. But having breast cysts does not increase the risk of breast cancer in the future. That's number one. Number two is
if you found a lump at a younger age, maybe after a few years, it's gone. Is that possible?
So most of the time, at a younger age, about 20-somethings, the estrogen level in women is actually coming to the peak, okay, and then all the way to almost menopause, where it start to come down. So a lot of benign lumps, such as fibroadenoma, breast cysts, are actually estrogen dependent. So most of the time they will regress towards menopause. However, some of them don't. So we have a rule of 3, 1/3. So 1/3 slowly increasing, 1/3 stay the same, and 1/3 will regress. The last one is about calcification. Calcification are usually detected by mammogram. Calcification can be divided into benign or malignant. Malignant is cancer. So not all calcification are malignant and can be monitored. But whether the calcification can regress, sometimes that happens again, but we do not know. What I can say is we will usually monitor this calcification once we confirm that this is benign.
Thank you. So below 50 years old, how many times do you go for your mammogram? How often do you go? Yearly, okay. After 50? Every 2 years. If between 2 years you feel discomfort, go, yes. Within 1 year you feel something not right, go, yes, very good. All right. Let's please thank you our Dr. Jerry Khoo, Ms. Dr. Lim, Ms. Chong, and Dr. Peck. Thank you very much for your Saturday. Please stay healthy. My name is Ivy Lim. Have a great weekend. Thank you very much. Thank you.